Carolyn Boone was born December 10, 1936, in Roxborough, North Carolina, the only child of Dr. R. Irving Boone, a college professor and Baptist minister, and Vivian Boone, an elementary school principal. Raised in Wilmington, North Carolina, Carolyn attended segregated schools, and at the early age of 16, she matriculated to Hampton Institute, a place she described as her home by the sea and where she pledged Alpha Kappa Alpha sorority. As a young adult, Carolyn had an immense love for life. She would later share with her family of her own: son, Irving Lewis, daughter, Donna Lewis Johnson, and two grandchildren, Kelsey and Jordan, of whom she adored. Her love extended to her church family at St. Timothy's Episcopal Church in Washington, D.C., where she diligently served for more than 30 years and was a member of the Order of the Daughters of the King. Carolyn had a zest for life and a passion for the underserved she fulfilled by working on their behalf. She was the first African American chair and trustee of the American Hospital Association and a healthcare advocate for all. She was a member of the Philadelphia Stock Exchange, chair of the Metropolitan Washington Airports Authority, and commissioner of the Joint Commission on the Accreditation of Healthcare Organizations. Those who knew her well knew her best.
I'm Virgil Clark McDonald, a member of the board of Nexus Health. I've served on the board since 1995, and for 10 years, 1998 to 2008, I served as board chair. One of the proudest moments during my tenure as board chair is when we renamed the Healthcare Institute the Carolyn Boone Lewis Healthcare Center. Carolyn was my personal friend. She was my colleague on the board. She was my neighbor and a member of my church. I admired her and what she had done for the community. Not only was I proud to do it, rename the facility in her honor, it was unanimous when it was first presented to the board. Nexus Health is a predecessor organization of the Greater Southeast Healthcare System. Carolyn served on the board of the Greater Southeast Healthcare System, and for several terms she served as the chair of the board. One of the most important things that a board can do is to name facilities in honor of people who make outstanding contributions. It was indeed an honor to rename the Healthcare Institute in honor of Carolyn Boone Lewis because of the service that she provided to this community, to the nation, and to the world.
I'm Jeremiah DeMichaelis. I came across town from Georgetown to the CBL Center out of my respect, love, and admiration for Carolyn Boone Lewis, whom I first met in the late 1960s. For the next 30 years, we were colleagues together at the U.S. Securities and Exchange Commission, where she managed a large staff of attorneys and accountants. Her specialty was the regulation of U.S. mutual funds. Today, mutual funds hold more assets than all U.S. banks. And this was an industry that was represented by powerful interests. She was unsurpassed in her ability to navigate and negotiate complex financial transactions after those transactions pitted an industry's interests against the investing public's. She never lost sight of who she represented: the American public, the investing public. My contact with her was very close. I would meet with her daily for hours at a time. She not only taught me the federal securities laws, but also taught me something about social justice and diversity. I came from New England, raised in the 40s and 50s, where diversity was finding broccoli and cauliflower on a menu along with carrots and peas. Her passion was social justice, and she taught it by her example. To say she was highly competent is an understatement and would not do her justice. Her personal attributes of grace, diplomacy, mild-mannered, and even temper gained the admiration of friend and adversary alike. She went on to become chairman of a major hospital, board chairman of the DC Lottery Board, a member of the board of the American Stock Exchange, and a member of the board of the DC Metropolitan Transit Authority, among other accomplishments. A career and a life worthy of recognition. She is sorely missed by many. You have chosen well, dedicating such an outstanding health facility to her honor.
Good evening. I'm Bill Johnson, a long-term friend of Carolyn Boone Lewis. I met her in the spring of 1954 on the campus of Hampton Institute. A group of us were figuring out who was going to take whom to the annual ROTC ball. I'd come to know Carolyn as a real and genuine person, true to herself in all she touched and loved. Carolyn was a skilled executive at the corporate board level and blessed with extraordinary management skills and a profound problem solver, with a strong consensus-building ability among her fellow board members. She was fiercely competitive and engaging, but able to merge wise thoughts with disagreement among her peers. She was the spirit of consensus building. Carolyn was a hero to the underserved, underprivileged, the put-outs, the kicked-outs, and the unloved. She was intensely intuitive and introspective. Carolyn was ever the feminist and a consummate lady and a woman for all seasons. While our families vacationed together for many years at Nags Head, North Carolina, among other places, Carolyn thought she would try a hand at hang gliding at Kill Devil Hills. We joined her at the jump site and watched her nervously being hitched to the hang glider, and for the first time in her life, she believed she could fly, and she did. From a 4,000-foot mountaintop, she knew she could fly, and she's still soaring now.